my speech to inform. So basically, hip dysplasia has changed my life in many ways. It has caused me to give up the sports that I want due to pain that was unavoidable. But after having surgery, it was fixed, and now I'm back on a new lease of life without any pain at all. So each year, thousands of children and adults are affected by hip dysplasia. That's a big number, and if it's affecting thousands of people, we don't really know what it is. So what exactly is hip dysplasia? According to hipdysplasia.org, hip dysplasia means that the bones of the hip joint are not properly aligned. Hip dysplasia is known by many different names, such as developmental dysplasia of the hip, loose hips, hip dislocation, or congenital dislocation of the hip. Hip dysplasia will not allow the hip joint to function normally, making sure that the joint wears out much faster than usual. And this can be compared to kind of a car tire. If they're aligned properly, you'll get many more miles on your tires, but if they aren't aligned properly, they'll wear out faster. This is a silent condition. Basically, that means that pain isn't felt in later on in life, so you may not know that you have it right away. So who can have hip dysplasia? It can affect both children and adults, although what it is called differs between the two. Hip dysplasia in children is known as DDH, and according to hipdysplasia.org, 1 out of every 20 full-term babies will have some hip instability, and 2 or 3 of every 1,000 infants will have to have treatment to fix that instability. Even though that is somewhat a large number and could cause lifelong problems, it's very little known outside of the medical profession. Early diagnosis and treatment will help to prevent and solve this problem. Now, hip dysplasia in adults, the most common is hip arthritis, and that's usually where we see our hip replacements. In 2008, a study in Norway showed that more than 90% of young adult cases couldn't be diagnosed in childhood due to the current screening methods that we have for hip dysplasia. So research done by the International Hip Dysplasia Institute are trying to find solutions to this to make this more known. Now, developmental dysplasia of the hip, going into what children have, the DDH, it's basically the general term used for what babies and children have, and it's often known as hip dysplasia, hip dislocation, developmental problems, or even the congenital dislocation, which is where something is added or taken away from the tissue. So what causes this? There is no known cause. It's strictly developmental, but if someone else in your family does have hip dysplasia, you are 30 times more likely to have it. And according to hipdysplasia.org, 1 out of every 10 newborn infants will have some form of hip instability if a parent has hip dysplasia. And also how the baby is in the womb can affect if you have hip problems in your baby. Some signs or symptoms are asymmetry, a hip click, limited range of motion, pain, or an arched back in a baby. So usually the treatment options involve a brace put around the baby so they can't move and to fix how the hips actually are. Surgery usually isn't required unless you are an adult. Which brings me to adult hip dysplasia. Some signs and symptoms of that are if somebody has hip pain or a limp, clicking or popping noises, and hip pain, which is usually deep in the groin area, or side or back hip pain. And the limp will start out mild and go to severe. Basically, this can be diagnosed through x-rays or the severity, and if it's very severe, surgery is usually one of your only options. Which brings me to the adult treatments. General treatment is basically surgery to preserve the hip. The earlier you're diagnosed, the better it is to have surgery then. You'll recover better. So hip preserving surgeries are, the main one is a periactibular ostomy, or a PAO, and that's what I have done. As you can see, I have 3 screws on both sides of my hips, and it's to hold it in place because in this one you can see that the hip is actually coming out of the joint. So basically, it pushes the hip back into the joint so you can kind of walk normal again. And other options are a joint replacement or an arthroplasty, such as a total hip replacement. And if your case is too bad or too severe, they may actually not be able to do anything for you. But if it's mild, some changes such as weight loss, lifestyle modification, joint injections, or physical therapy could be an easy fix. No matter what the age, hip dysplasia is described as best, according to Mayo Clinic, as a medical term for a hip socket that does not fully cover the joint. An abnormal structure will put the excessive pressure on this joint and can cause arthritis as early as age 20. The condition can change a person's life entirely, and it's best to take the proper steps and make sure that's caught early on.